Force is pitching his healthcare reform to Americans in a series of town hall meetings across the nation. Some of his supporters are also hosting similar events, and some of which have been very emotional and very divided. Here to join us to talk about those meetings, including a recent one, a very large one in Pasadena, is Mike Alexander with the Pasadena Patriots. Is it Pasadena Tea Party Patriots or Pasadena Patriots?
Tea Party Patriots, although our website is PasadenaPatriots.com.
Okay, you and hundreds of supporters, in fact more than 2,500 we were talking about, we're at this town hall meeting with Congressman Adam Schiff. Very lively discussion and debate. What did you get out of it, and how would you assess the success of the meeting?
Well, what I got out of it was very little on the policy side. Let's talk first about the attendance. As you and I were discussing off camera here, Congressman Schiff and I agreed that there were probably anywhere from a minimum of 2,000 people up to 3,000.
Okay, we're seeing some of that here.
Right. My estimate would be there were about 500 to 1,000 contract players brought in by the unions and the Democrat operatives, and then the remainder, 1,500 to 2,000, were all citizens and very concerned. And of that number, a great number of those were members of our organization, which is very loose.
Now, when you say contract players brought up by the unions, there's been a lot of debate about the genuineness, if you will, of both sides, because the Democrats are accusing your side of being manufactured by conservative groups, and you're saying that Obama supporters are contract players by the unions.
Well, there's really no question about that. There were advertisements on Craigslist paying them $10 or $12, $15 an hour to come and protest. So that's fine. That's a legitimate form of organizational participation. One can question their sincerity, but they certainly support a point of view. On our side, clearly, it was a grassroots effort because we don't receive money from anybody. It's all volunteer. This myth of insurance companies supporting us is exactly that. It's a myth. We don't receive any money from them. If they'd like to pony up some capital to help us oppose this nonsense, we'd be glad to take the money.
Sure.
But the fact is that the fix is in at every level with every major institution in the country.
But there are some larger organizations like Americans for Prosperity that are funded by some corporations. So do you coordinate with them, or you're independent?
We're quite independent. We're aware of those folks. We haven't heard much from them except to visit their website. We'd be happy to cooperate with anybody in opposing this and other examples of excessive government. Our opposition isn't just limited to this health care program, but to a growing, festering socialist apparatus that has spent itself into oblivion. That's our problem.
Well, let's get into the meat of that. Is your bigger concern that the government is getting involved more in health care, or the costs, or both equally?
Well, there's no way to distinguish between the two, because the first thing the government does by injecting itself further, and I'm glad you used the adverb further, because the fact is the government's been involved in health care for 50
Medicare,
years.
Medi-Cal.
Correct. It's a huge problem. They have no track record of running it well or really efficiently at all. Now they want to take over the rest of the healthcare system and interfere with our private arrangements between our physicians and the insurance companies. So they want to nationalize the doctors, and they want to nationalize the insurance companies and manage the whole process. We object to that.
But the public option, though, they're saying is just one part of it, and that private insurance companies will still be able to exist. I mean, it's not quite a nationalization, is it?
Jeff, of course it is. First of all, it's nationalization the moment that you concede that the government has a right to exercise at a federal level complete and final authority in the area of regulation of health care in this country. Once you can see that, they've nationalized the area. It is only the extent to which they've done it. And let's talk about this public option. The fact is the public option very soon becomes a public no option. Once the terms of the insurance coverages are changed, or if the employers terminate the programs because their pricing is now being undercut by the so-called public option, then the participants are going to be forced into it. Of course, one of our problems, Jeff, is...
Ted, by the way.
Excuse me, I'm sorry.
It's okay.
Excuse me.
I know I look like
Ted.
a Jeff, but...
my bifocals...
No worries, no worries, no worries.
One of our problems, Ted, is that we're just dealing with the House version. We don't know what the final version is. We've got, we don't know what the president's version is. We're dealing with a lot of speculation. And go ahead.
Oh, we have one more question because we're running out of time.
Yes,
but
sir.
if the government doesn't get involved in terms of making sure insurance companies don't disqualify people for pre-existing conditions or kicking them out because they get sicker, or controlling costs, who can do all those things besides the government?
Well, the first question is, who ought to be doing those things? You and I don't have time to go into that, and this would be talk about. I don't want to get into that. I'd rather address it in this fashion right now, Ted. There's one issue I agree with the president. There's very few areas that we agree with him, and that this is a lousy way. And the place to have that debate was through a normal, functioning congressional legislative process, but we didn't have that.
Okay, so you don't like the town hall?
Well, the town halls are fine. They're our only alternative because they aborted the normal legislative process, shove all this thing through with party discipline in a matter of weeks or months. This is an enormously complex area.
Okay, we are going to talk about that. Thank you so much. Yeah. We hope to bring you back later because on this issue, obviously.
Thank you.
Mike Alexander of Pasadena Patriots, thanks so much for joining us.
PasadenaPatriots.com. Thank you.
Okay,
Yeah.
we'll be right back.